Hello, ladies and gentlemen, and welcome to another episode of the Molarbear. Today, we have a distinct pleasure of speaking with Dr. Varun Jain, sir, a renowned dental specialist and an orthodontist with over 13 years of experience in the field. Sir has hailed from the bustling city of Mumbai, India, where he is a clinical head and an owner of Smile Sutra multi-speciality dental clinic and implant center and orthodontic center, boasting three branches across the city. Additionally, he has been practicing as an international visiting specialist orthodontist in UAE for past 7 years, consulting in various reputed hospitals and clinic in Dubai, Abu Dhabi, and Sharjah. Sir is also certified expert in lingual orthodontics, mini implants, and Invisalign. And he is passionate about practicing digital and futuristic dentistry. Welcome, sir. Welcome to the show. Hello, sir. Welcome to the
Thank you,
show.
thank you, thank you. Thank
So,
you very much, Ganendra. Thank you so much, Dr. Ganendra. This is a pleasure being out here. I think this is a very different experience for me because अब तक जितनी भी बार मैंने किसी से बात करी होगी, it would be face to face, talking eye to eye to the person. This is for the first time I'll be talking, on a microphone. So I guess this is a very new experience. I'm thrilled, excited. Let's take it up.
thank you very much, sir. The excitement is same here, sitting on the another side. Well, sir, to begin with, let's start at the beginning of your journey in dentistry. Can you tell us how you first became interested in the field and what inspired you to pursue a career in dentistry?
So, Dr. Ganendra, I always knew that this could be the first question that we could start our interview with. And trust me, I never wanted this to be the first question. वो होता है ना that your first impression is your last impression. But मेरे साथ I don't have a very inspirational or a very motivational beginning to dentistry. So I never wanted this to be my first question. But to be honest, I hope this touches somebody's heart somewhere and they could make a wise decision in life. So basically for me, this is going to be very astonishing for everybody to know, but I never planned to become a dentist. I belong to a family of doctors. घर में बहुत सारे doctors हैं. I grew up seeing my dad, moving in and out of hospitals, getting into clinical practices, having patients come over home. So यार एक चीज बहुत clear थी life में that I wanted to become a doctor. बहरहाल जैसे जैसे I started growing up, I was always somebody who did something that I was told never to do. So I think because of that, that whole thing of doing things that I was not supposed to do, I guess I was a very notorious child. I was not very, like, until 8th standard, I used to be scoring really well in my exams. And then I think the teenage hormones hit me really well. And I got absolutely, carried away in my teens where I was like, not very glued to my books. And I got carried away in a wrong fashion where I was not very inclined to my academical side of it. But somewhere or the other, I always knew deep within me that I wanted to get into what I wanted to get into. And I was sure that मुझे medical field से related ही कुछ करना है life में. I think उस दौरान what happened was because I was not so much into my academics, मैं college बराबर attend नहीं कर रहा था. I mean I was bunk मार रहा था college में, काफी ज़्यादा यहाँ वहाँ की मस्तियाँ चल रही थी. उस दौरान I guess some of my uncles, he just happened to tell me and mention to me that yeah dude, why do you want to get into medical science? Why don't you try and do dentistry? पापा के पास इतनी सारी emergencies आती है, you'll have a life which will be very easy. You'll have a fixed working hours, which not so many emergencies coming to you. आराम से you can earn good, you can have a peaceful life. And I was like यार डॉक्टर तो बनना ही है. So let's do this way rather than getting into something which is more complicated. Let's start getting into dentistry, and this is my reason how I got into dentistry. I hope this does not get misled to a lot of other listeners. But to be very honest, as I told you, my reason to get into dentistry was not very inspirational. But this is the reason why I got into dentistry. But I'm really, really, really glad that I did this decision. I got into dentistry, and today where I am is what I am.
Wow, so really, not that really inspiring. I'll say this is not the case just only with you. All the leading dentists in India have always thought, never thought that they would get into dentistry, and however they landed. And look at you now, where you are at the peak. Anyway, sir, so sir, dentistry was fine. How did you develop an interest into orthodontics, sir? You could have gone with other
Yeah,
departments also.
yes, absolutely. So I had always a knack in me to love what I did. So after I got into dentistry, I was very clear about one thing that, yeah, Abhi, I have chosen this, so I have to do this. And I started falling in love with dentistry. I always tell everybody in my life, you cannot be a jack of all and master of none in life. So you just kind of be a jack of all and master of one. So I understood, I tried figuring out what my passion and love in dentistry was. And I figured out that orthodontics really excited me. Other than the whole fact that people told me this is the first specialty field of dentistry, paise bahut achhe hain, keeping this off records. But that was also one of the reasons why I got attracted to it. And I was like, okay, yaar, when everything looks very lucrative, let's go ahead and do what you love. So I guess that's how I started getting into dentistry with orthodontics.
Wow. So, a key point, guys, you will fall into dentistry. Dentistry is a very lovable subject, and you'll have a very good journey into dentistry. So, if just in case of beginners who are new to dentistry can put a point on this. Well, sir, starting a dental practice can be really challenging. It's actually is a challenging job. Can you share some of the difficulties you faced in your early days as a dentist and how you overcame it?
So I cleared my dentistry back in 2012. That's nearly like say 12, 13 years from now. So I guess normally क्या होता है ना, once you are into your bachelor's, you finish your bachelor's, you uh, quite a lot of people happen to get into their post grad. आप जब पोस्ट ग्रेजुएशन खत्म करते हैं ना, तब तक आपको ऐसा लगता है कि आपने ना ये लाइफ में एक बहुत बड़ी सेंस ऑफ अचीवमेंट होती है आपके अंदर. आपको ऐसा लगता है द होल वर्ल्ड इज वेटिंग फॉर यू द मोमेंट यू गेट आउट ऑफ ए कॉलेज. देयर विल बी अ लॉन्ग क्यू वेटिंग फॉर यू कि मुझे जैसे ही आप आपकी पोस्ट ग्रेजुएशन खत्म करेंगे, आपके पास बहुत सारे पेशेंट्स की लाइन लगी होगी, and वो सारे के सारे आपसे ट्रीटमेंट कराने के लिए वेट कर रहे होंगे. बट ट्रूथ इज स्ट्रेंजर देन फिक्शन. सच और काल्पनिकता में बहुत फर्क होता है. सो आइडियली ऐसा होता नहीं है. बट द मोमेंट यू स्टार्ट फिनिश योर your post graduation, you start coming out in the real world. That's when you realize that the actual race begins then. अब तक तो आपने सिर्फ अपनी रेस की तैयारी करी है. You've just prepared about the real life, that how your real life journey is going to be. So you've just prepared for the journey. With me, when I started back then, I had a few plans, that I would do a certain things. I would do certain things I would look into when I'm outside into the world. uh, as I mentioned, मुझे ऐसा लगा था कि बहुत बहुत easy होगा, but actually इतना easy था नहीं तभी भी. एंड आई गेस आज तो थोड़ा सा ज्यादा डिफिकल्ट हो गया है, आई गेस. बट तभी भी बहुत ज्यादा इजी था नहीं. मैंने कुछ दो तीन चीजें सोच रखी थी. If I'm sure Dr. Ganendra, and the listeners would be aware of the brand Invisalign. Back in 2011, what I did was I thought that let's do one thing. मैं मेरे कॉलेज पोस्ट ग्रेजुएशन डे से इनविजिलाइन से बहुत ज्यादा अट्रैक्टेड था, बिकॉज मुझे ऐसा लगता था कि दिस इज समथिंग न्यू. दिस इज समथिंग व्हिच इज गोइंग टू बी द revolutionary side of dentistry. This is something which is going to be the future of dentistry, where you're not looking into a lot of braces, and you're looking into most convenient, socially acceptable part of the treatment. So मैं मेरे जो हमारे जो केस प्रेजेंटेशंस होते थे, या CMEs होते थे, उसके अंदर आई यूज्ड टू बी वेरी इंटरेस्टेड इन द अलाइनर एंड द क्लियर अलाइनर साइड ऑफ इट. सो मुझे बहुत इंटरेस्ट था कि मैं पोस्ट ग्रेजुएशन खत्म करने के बाद में आई विल डू समथिंग विद द clear aligner field only. At that point in time, the pioneer in the clear aligners was Invisalign, Align technology. So what I did, I came out and one fine day, after finishing my exams, result आ गए, मस्ती मजा सब खत्म हो गई. बाद में हमने सोचा चलो थोड़ा सा काम कर लेते हैं. And one night I sat at home and मैंने एक Align technology का email address Google से ढूंढा और मैंने उनको एक बहुत एटीट्यूड वाला स्वैग वाला मेल भेज दिया उनको. मैंने उनको ऐसा मेल भेजा कि आई एम डन विद माय ऑर्थोडोंटिक्स एंड इफ यू वांट आई कैन वर्क विथ यू, यू कैन प्लीज शेयर योर प्रपोजल विद मी. अब मुझे ऐसा लगा था, जैसे मैंने आपको बताया ना, दैट आपको ऐसा लगता है कि दुनिया आपका वेट कर रही है बाहर निकलते से कि हाँ ठीक है यार, डॉक्टर वरुण ऑर्थोडोंटिस्ट बाहर आ गए हैं एंड अभी हमें ट्रीटमेंट करना है, बट ऐसा होता नहीं है. तो मेरा पहला मेल जब मैंने उनको भेजा, इनफैक्ट यू विल बी सरप्राइज, मेरे पास वो मेल आज भी होगा. एंड I mean, I have kept it in my archives. I have kept it as a treasure with me because that is so much of a learning curve that I have with myself. You would not believe, Dr. Ganendra, what happened. मेरे पहले मेल का रिस्पॉन्स भी नहीं आया. मुझे ऐसा लगा यार ठीक है, यूएस प्रोसेस है, मैं यहाँ पे दिन में बात कर रहा हूँ, वो शायद रात में देख रहे होंगे, तो कहीं ना कहीं हमारा सिंक नहीं बैठ रहा. तो मैंने सेकंड मेल करने का डिसाइड किया उनको. मैंने उनको अब ये मेल जो भेजा, ये मैंने उनको आई थिंक अगेन ऐसे ही मैं घर बैठा हुआ था, मैंने रात के टाइम पे उनको भेजा कि मैं बोला आई थिंक यू मिस्ड आउट ऑन माय फर्स्ट मेल, दिस इज माय सेकंड मेल टू यू, आई डोंट माइंड वर्किंग विथ Invisalign, if you want I will come over, I will get trained with you guys and then I will come back to India and I'll look into expansion over here. अब पहले मेल से कंपैरेटिवली मेरी थोड़ी सी थोड़ा सा एटीट्यूड, थोड़ी सी अकड़ थोड़ी सी कम हो गई थी, बिकॉज मुझे ऐसा लगा था यार ये लोग मुझे रिस्पॉन्ड भी नहीं कर रहे. तो सेकंड मेल में आई थिंक आई वाज अ लिटिल ग्राउंडेड, नॉट कंप्लीटली बट हाँ लिटिल, बिकॉज अभी भी मुझे ऐसा लग रहा था कि मैं ऑर्थोडोंटिस्ट बन चुका हूँ, तो अभी दुनिया जीत लेंगे. बट आई गेस सेकंड मेल का भी 2-3 दिन वेट करने के बाद में कोई रिस्पॉन्स नहीं आया. तीसरी मेल तक मुझे समझ में आ गया कि यार कुछ तो गड़बड़ है. सो आई गेस थर्ड मेल जब मैंने उनको किया, मैंने उनको बोला मतलब, एंड तब तक मेरी अकड़ काफी कुछ लेवल में आ चुकी थी, तो मैंने उनको बोला मतलब एक काम करते हैं, आप मुझे बताइए क्या कर सकते हैं. आई एम रेडी टू इन्वेस्ट ऑल्सो माई टाइम, माई एक्सपर्टीज, एंड आई विल वॉन्ट टू प्रपोज यू दैट वी विल ब्रिंग Invisalign to Asian continent. Because I guess Invisalign at that point in time had their presence in certain parts of Asia, but then they did not have it majorly in all the Asian countries. So I guess इतने सारे mails के बाद one fine day I got a one-liner email from them that as of now Align Technology is not looking at expanding in that region. I was like, यार मैं इतने दिन से इतनी मशक्कत कर रहा था. I was trying to get into this, and that was my plan A after I finished my orthodontics. So plan A तो मेरा एकदम फेल हो गया. बाद में मैंने सोचा अभी plan B जो है वो देखते हैं. Plan B was that like anybody and everybody else, as how we all postgraduates, once we get out of the college, what we try to do is we just print our visiting cards and we try and just visit clinics door to door, meet doctors, and keep sharing our cards with an intent, with a intention that someday we'll start developing a consulting practice. अब being me, how impatient I am, मैंने वो करना शुरू तो कर दिया, but बहुत ज़्यादा मुझे रिस्पॉन्स वहां से भी मिला नहीं. बिकॉज ऑब्वियसली बात है, जब आप नए क्लिनिक्स, नए डॉक्टर्स से मिलते हैं जाके, उनकी एक ऑलरेडी क्लिनिकल प्रैक्टिस सेट होती है, उनके पास अपना एक क्लिनिकल टीम होती है, उनके अपने डॉक्टर्स होते हैं, उनके अपने रिलेशंस होते हैं. सो ऑब्वियसली बहुत इजी नहीं था. सो आई गेस दैट वाज माय प्लान बी, व्हिच अगेन फेल्ड मिजरेबली. देन प्लान सी, जो मेरा प्लान कभी नहीं था, वाज दैट आई ओपनड माय ओन प्राइवेट क्लिनिक बाय द नेम ऑफ स्माइल सूत्रा. एंड बस उसके बाद हमने कभी मुड़कर पीछे देखा नहीं, एंड दिस इज व्हाट इट इज.
Wow, sir, that's actually insightful. And now, considering your sustainable national and international achievements, can you tell us more about the highlights of the career? What do you believe contributing in recognizing as a specialist dentist and an orthodontist?
So yeah, Dr. Girinder, as I was always mentioning that it's very important to fall in love with what you do. I guess this was one thing which was always there in me. I was always loving what I was doing. Like everybody has, something in their lives that they feel happy about. I guess for me, I always felt happy about spreading terrific smiles. So this is what was, my superpower, and this is what was my passion. It was just a journey which I kind of enjoyed, and I'm still on the journey. Majorly, what exactly happened was Bombay, India, वाला तो ठीक ठाक चल ही रहा था. I
Hmm.
was over here consulting in a few hospitals and a few clinics. I had my own private setup. One of my family friends, they just happened to always tell me that why don't you do something abroad. I was like, यार abroad कहाँ पे कुछ कर सकते हैं, because your Indian post graduation is not validated. I guess you'll have to again go back in certain countries where you would want to go. You'll again have to go finish with your your basic sciences. You'll have to finish with some basic years of your colleging, and then you can get a license to practice. So I did not see a lot of opportunities that ways. But एक बार हम ऐसे ही family holiday के लिए गए थे, and we were at Dubai, and dad's friend, he being a doctor over there, he just happened to tell me that, dude, you're an orthodontist, you should try and set your foot over here in UAE, and it's a very lucrative prospect. And this was back in 2015, 2016, I guess. I think just 3 years, 4 years after my postgrad, and that's how it started. So yeah, मैंने उनकी राय थोड़ी सी seriously ली. मैं बोला चलो थोड़ा सा कोशिश करते हैं. And that's how I appeared for the examination. I cleared, and it's been since then till today that I am continuing with the whole expedition.
Wow, sir. So, would you mind to just elaborately tell us the process? How did you get into the medical system? How did you get the license to work there in UAE for our listeners, maybe?
Sure. Why not? So I guess during 2015 there was not so much of a awareness about practicing abroad. And specifically, when I'm saying practicing abroad, people normally had an option of relocating themselves. Not everybody kind of understood the fact that they could be a visiting specialist or a visiting consultant, practicing in another country and then getting back to their home countries, and then continuing with their day-to-day lives. मेरे साथ, as I told you, that doctor friend of my father, he just happened to tell me about this thing, and then I just kind of researched, uh, did some understanding about the whole thing. During 2015, I guess we had, uh, because I had a little background of family of doctors around me. They kind of helped me a bit, but then because none of them were dentists, it was not a very 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 helpful input that they had. But I guess thoda sa, as I told you, I always love to do what I want to do. So I fell in love with what I wanted to do, and I tried figuring out what exactly was the whole process of getting into Dubai Health Authorities. That is the Dubai's local examination. So मैंने दुबई हेल्थ अथॉरिटीज की वेबसाइट फिगर आउट करी. मैंने वहाँ से उनको कॉल्स करे. आई ट्राइड अंडरस्टैंडिंग द प्रोसेस दैट इन 2015. फिर उसके बाद मुझे समझ में आया कि हमें एक सर्टेन लिस्ट ऑफ डॉक्यूमेंट्स रेडी करने हैं. वो लिस्ट ऑफ डॉक्यूमेंट्स हमें सबमिट करने हैं. धीरे धीरे वो हमारे डॉक्यूमेंट्स verify होते हैं, and then one fine day after the verification is approved from the Dubai Health Authorities, they will let us choose a date for an examination. So this is a MCQ examination that we appear for, and once you clear the examination, you will get validity. Like it's like you get a certificate where you are allowed to practice as a dental specialist in the country. Once you get that certificate, you have to convert that certificate into a valid license.
Okay.
So it's an eligibility letter. So once you're eligible, you have to convert that eligibility letter into your license. You have a period of 1 year, if I'm not sure about the certain laws that keep changing. And as on today, I'm not very sure about the laws. But back then in 2015, what exactly happened was, once we get the eligibility letter, we finish our exams, we get the eligibility letter, we get a year's time to convert this eligibility letter into a license. And once you get your license, you're free to work over there.
Wow, thank you, sir. This could be a very good piece of information for our listeners by you. Thank you once again, sir.
Most welcome. Yeah, most welcome. Most
Your
welcome.
work in UAE is also net worth. Can you share with us how you started practicing in UAE and what unique experience or challenges you have encountered while working in Middle East?
So, सबसे पहले तो the basics remains the same everywhere. People might have a lot of mental block that the dental science or the medical science internationally is going to be very different. Trust me, everything 70% to 80% remains the same. Yeah, कुछ चीजें for sure change होती है because of the regional varieties, the regional diversities. You have a lot of changes that would be there, but then that will only be 20% of your natural instinct in your dental science. So I guess that 70% is absolutely the same. UAE, I would say Dubai is a very cosmopolitan kind of a city. And belonging to Mumbai, which is again a little cosmopolitan, I don't think I had a lot of difficulties. I would say Dubai is a ultra polished version of Mumbai, and I think I could settle myself up pretty well over there. The most difficult part is when you have the eligibility letter and you want to get it converted into a license. You really have to make sure that meet people, you have good connects over there, and you get into you get into some clinic or some specialty practice which lets you get on board with them. So I guess fortunately with me, I was blessed. I was वो बोलते हैं ना, you just have to be at the right place at the right time. I think I was
Yeah.
just one of them. मैं सही टाइम पे सही जगह पे पहुंच गया, एंड शायद मैं सिर्फ अपने एलिजिबिलिटी लेटर के बाद में आई वाज जस्ट ट्रैवलिंग ओवर देयर टू जस्ट फिगर आउट what how exactly do I have to explore this, because as a teenager or as a son, you're always growing up where you have some or the other influence from your family. You're somewhere or the other, your family is trying to back you up, they're trying to support you. मुझे एक चीज समझ में आ गई कि ये जो मैं कर रहा हूँ, दिस इज गॉट नथिंग टू डू विद माय फैमिली. माय डैड हैड नो कनेक्ट्स ओवर देयर इन दुबई, एंड आई थिंक दिस इज व्हाट वाज माय मेजर थ्रिल, बिकॉज मुझे एक चीज समझ में आ गई दैट आई कैन ऑलवेज से दैट व्हाटएवर आई हैव डन, I can take the complete credit to it, and I can always say that this is what I have done is all by myself, and I had no support from anyone whatsoever. So I guess that's how I started. I explored, and I was there at the right place at the right time. And मैं गया वहाँ पे. I guess third day I had the job in my hand, and I started. So that's how it was.
Wow, sir. This was really, again, motivating people. So this would
I
motivate.
hope I am. मुझे ऐसा लग रहा है, लोगों को ऐसा ना लगे कि यार ये बंदे ने नहीं कभी सोचा था ये डेंटिस्ट बनेगा, तो भी डेंटिस्ट बन गया. But I guess like everything in life, hard work, your commitment, and your dedication and passion towards the job what you're doing. Like, let you be a salon guy, let you be a barber, let you be a hairdresser, let you be a nail artist, or let you be anybody in life. As long as you have the hard work, the passion, the commitment to accelerate, and do well in the field, I guess everything can make you successful. So yeah, this is what it is.
Awesome. Well, moving to some technical parts, your focus on phase driven orthodontics is actually very amazing. Can you explain this approach and its significance in your practice, sir?
Okay, phase-driven orthodontics. So basically, orthodontics, as obviously everybody would know, orthodontics is a specialty dealing with cosmetics, aesthetics. It's about beautification of smile, setting up teeth straight, get them into a proper position, getting your jaws in proper position. That's what orthodontics is about. For me, I don't know. I always gave more priority to the face value over the teeth relationship. Your smile did excite me, but smile as a whole, like a smile could complement 100% on an overall existing face. आपकी अगर मेरी ट्रीटमेंट के बाद अगर आपकी फेस वैल्यू एनहांस नहीं हो रही, तो आई डोंट थिंक द ट्रीटमेंट इज डूइंग अ लॉट ऑफ गुड टू एनीबडी. So face driven orthodontics is something where you are looking at, enhancing the person's or the patient's overall persona, overall personality, where orthodontically you're trying to enhance their face, their personality, and making sure that whatever treatment you do will add up to them, and not just looking at the teeth position. Like sometimes, like as we always say, this is going to be a little technical, but like normally we say that the overjet overbite should be around in the range of 2 to 2.5 millimeters. Sometimes I don't mind keeping it a little more or keeping it a little less in case if I want to give a little more fullness on the lip, or if I want to play around with the profile. So
Hmm.
basically, I look at facial profiles more prominently rather than looking at only teeth. So that
Okay.
is face-driven orthodontics.
Wow, sir. This was great to hear from you. Well, sir, your expertise in various treatment modalities is quite impressive. Could you share some of your insights into the specific techniques and treatments that you offer, such as myofunctional appliances and lingual braces?
So, Dr. Ganendra, myofunctional, तो I think that is one thing which I love to do. बहुत ज़्यादा करने मिलता नहीं है because इंडिया में awareness थोड़ी सी कम है अभी भी. There are sometimes अभी भी there are sometimes where we have uh, we have the patients being misled by some doctors where they are told that you should visit or you will need treatment once your baby teeth fall off.
Yeah.
Unfortunately, ऐसा बहुत बार होता है, but I would want to put this on record to everybody who's listening that your first visit to an orthodontist for any patient should be by the age of 7 years, when your baby teeth start falling off and your adult teeth start coming in picture. Ideally, it's not necessarily that we would want to address to the treatment at that time, but there are certain underlying situations like skeletal corrections which needs early intervention. So in such situations, sometimes we would want to go ahead with myofunctional treatments at an earlier stage. Like I have patients of varied ages. Like I might have patients of the age even 7 up to the age of 70. And unfortunately, because the patients don't come to us early, we are not able to treat a lot of myofunctional cases in a natural form. So sometimes they get into their growth spurts are over, and then we will have to try and get into more adverse or a more aggressive mode of treatment, like which will go in for extractions, or we might need to do surgical intervention. So I love to do myofunctional because I feel that's the ultimate pleasure and the ultimate satisfaction I get to my job when I am able to offer these treatment options to my patients, and I can touch, move, and inspire the patients' lives in a way that they are getting a treatment done which is the most appropriate and the most preferred option for them, rather than going in for very aggressive options like surgeries or extractions. So I guess if the patients come to us at the right time, myofunctional appliances, they work amazingly well. Like मान लीजिए अगर किसी को बहुत ज़्यादा deep bite है, या किसी का lower jaw is underdeveloped or the upper jaw is underdeveloped, or either of it is overly developed, so we can surely look into it, right? So now coming back to lingual braces, I guess I used to do a lot of lingual braces initially in my career, Dr. Ganendra, but then to be very honest, I now have shifted myself to a lot of clear aligners. Lingual braces बहुत अच्छे थे, but I guess थोड़ा सा थोड़ा सा cumbersome थे because they were placed on the lingual surface, on the inner surface of your teeth. Sometimes speech was an issue. Sometimes breakages were so much of an issue, and obviously not every appliance is suitable for every case. Lingual braces बहुत सी चीजों में अच्छे थे, बहुत सी चीजों में हमें difficulties भी होती थी उनमें. So I guess I've shifted myself from lingual braces to a lot of clear aligners because there are no breakages, there are no major emergencies that we're facing, and I guess if you have the right, appliance or the right mode of treatment in the right hands, anything and everything can do wonders.
Wow, so to be very honest, I practice in a tier 2 city, and myofunctional appliances are just a dream. I just read it in book, and after that I didn't see this. It's good to hear that people practice myofunctional, and it gives us such good results. Well, uh, it's a bit personal question now, sir. That I have seen you very active on social media, right? So I keep on seeing your reels, your post, everyday case presentations. They are actually very wonderful. I would like to ask you that how is social media impacting your dental practice, right?
Yeah, so social media is something which is very close to me. I would, but it's like क्या होता है ना, everybody has a little bit of inhibition in themselves, especially doctors. By the society, there is a image, there is a stereotype that the society carries with the name or the tag doctor. You have a prefix to your name. If you're a doctor, you're supposed to be, certain XYZ point one, point two, point three should be there in you, which is
So
very
true.
stereotypical. Yeah, which is very stereotypical. मुझे ऐसा लगता था कि यार, let's do something and break stereotypes. डॉक्टर खड़ूस होना जरूरी नहीं है. डॉक्टर स्माइल करके बात नहीं करे ऐसा जरूरी नहीं है. डॉक्टर आपका दोस्त बन सके ऐसा जरूरी है. ऐसा ना हो कि डॉक्टर के पास आए, आप 2 मिनट बैठे, आप it was always very not very okay for me to just be the stereotypical doctor. I thought, let's break stereotypes. Let's try and make dentistry a little less fear driven. Normally लोग dentist appointments, dental visits और dentist के नाम से वैसे ही इतना डरते हैं, because tooth pain can really be dreadful at times. So I thought, let's do something so that the fear and the apprehension that the patients have about dentists and dental visits can be reduced to quite an extent. And what better than social media could it be? What I started doing, I have a busy schedule. And I think everybody has a busy schedule. But what I started understanding was that I will have to find time for this. मुझे बहुत अच्छा opportunity तब मिला जब मैं travel नहीं कर रहा था during COVID. I was back at home. The flights were not operational, so my visits to Dubai also were stopped. And I think उस दौरान what I thought, because me being the impatient guy that I am, मैंने सोचा ऐसे आराम से बैठ के तो बहुत मजा नहीं आएगा, तो कुछ करते हैं. And that's when I started with my social media journey. मुझे अभी भी पता है जब मैं पहली बार मुझे हम हमारे किसी एक इन्फ्लुएंसर ने मुझे बहुत अच्छे से याद है, जिस्सा पॉल, when she had come to the clinic and she told me that we will do some small reel where you have to dance. I was like, यार, मैं नॉर्मली एक थोड़ा सा कॉन्फिडेंट बंदा हूँ. मुझे नॉर्मली ऐसे I'm not very low on confidence ever in my life, but then that's one time where I started feeling shivers within me. I started understanding, like, यार ये मैं जो कर रहा हूँ ये ठीक तो है. I hope people don't take me otherwise, and लोग ऐसा ना सोचें कि यार इस बंदे के पास कोई काम ही नहीं है, ये सिर्फ ये सारी चीजें कर रहा है, and because you always, there is a good side and a bad side of you. There is a positive and the negative side of you, which is always trying to overpower you or trying to scare you from doing what you want to do. I guess I tried to control that emotion of mine, and I was like, chalo theek hai yaar, let's do something which is not very normally done. And the first time, I guess, when I made that reel with her, we got a lot of recognition. In fact, till date, Dr. Ganendra, where I have these influencers or creators, when they come in with their own concept, they come in with their own idea that, okay, Dr. हम ऐसा करेंगे, हम let's do this. And I was like, ठीक है यार, आप लोगों को जो करवाना है करवा लीजिए. And I guess जब आप कुछ ऐसा करते हैं, and जब हम ये चीज सोशल मीडिया पे डालते हैं, जब हम इस चीज का रिस्पॉन्स देखते हैं ना फ्रॉम द वर्ल्ड अराउंड, इट इज सो एक्सिलरेटिंग, इट इज सो प्लीजिंग, इट इज सो सैटिस्फाइंग. बिकॉज आई थिंक रिसेंटली अभी हमने कोई तो एक there was one actor, she had come for an implant treatment, and she told me that she has some concept in her mind, and she was like, let's do this. ट्रस्ट मी डॉक्टर गिरेंद्र, मैं आई थिंक 1-2 दिन पहले ही मैं उनके यूट्यूब चैनल पर गया. मैं यूट्यूब पे बहुत एक्टिव नहीं हूँ. मैं उनके यूट्यूब चैनल पर गया और उनकी वो रील, आई थिंक इट वेंट super viral. It was touching nearly 9 million views.
Wow.
And we had a big list of comments where everybody was just mentioning about one thing, कि dental appointments ऐसे भी हो सकते हैं. So I guess this is what I would love to do, where I'm trying to break those stereotypes, and I am absolutely enjoying this. Social media is is I would say is my work along with my core specialty. So I guess I'm really enjoying this, and when I can, as I told you, if I can touch, move, and inspire anybody's life, where अगर एक भी बंदा जो डेंटिस्ट से डरता है, अगर उसका डर मैं हटा सकूं, या if I can take their fear away, I think whatever I'm doing on social media is justified. So it's absolutely good.
Oh, wow, sir. That was actually great to hear that. A small piece of request. Maybe someday you can organize some webinar for all the dentists about social media and creating contents. That would be actually very helpful for us because
I
we
I will.
surely someday. Because the world here thinks that dentist ऐसा पिक्चर दिया जाता है बच्चों को कि चॉकलेट खाओगे डेंटिस्ट के पास ले जाएंगे. We have a lot of many web contents which tell shows thousand way of torturing while getting into dentistry. I guess you are aware of.
Absolutely, absolutely. That's true. See, I always tell everybody, in my life, in my clinic, and to my staff, I always tell them one thing: treat everybody how you would want to get treated. So, अगर आप चाहते हैं, that if you ever go to somebody and you want to be treated well, you will have to start from yourself. That you make sure that you treat people the way you want to get treated. So I guess if I wasn't a dentist, and if I like I had a traumatizing dental experience when I was a child. But as a person, you have to be very welcoming. As a person, you have to be very warm to your patients. As a person, you have to be very vocal, very outgoing, very empathetic towards your patients, to make sure that you are able to provide them with the right treatment for sure, but even a comforting experience.
Oh, wow. So thank you. Well, moving to the end of the show, a common question which I ask to every guest in my show, that what advice would you give to the budding dentist who aspire to achieve the level of success you have reached in your career, sir?
Okay, so budding dentists के लिए, I will just tell them that see guys, everybody is or was where you are today. मैं भी एक दिन ऐसा था जब मैं भी कॉलेज से निकला था और मैं आप ही के लेवल पर था. Don't underestimate what you've learned in college. Don't underestimate the value or the power of the theory that you've got from your college, because it's time to apply all that theory and amalgamate it with your practical knowledge in the field. Also make sure that you have the right amount of dedication, commitment, passion, and the zeal to learn. We are learning every day. अगर आप if you're okay to learn, if you're ready to learn, I think you will for sure accelerate and do well. Most importantly, as I always say, you should love what you do. So to every budding dentist who's listening to this episode of ours, uh, सबसे पहले एक काम करिए, fall in love with your dentistry. There is nothing else that should give you more satisfaction than spreading smiles or looking at your patients walking out of your clinics with a happy face. If you fall in love with dentistry, I guess rest all of it will be taken care of. वो बोलता है ना कि आपका वो शाहरुख खान का डायलॉग है ना कि आप किसी चीज को अगर तहे दिल से चाहते हैं तो पूरी कायनात उसे मिलाने में मदद करती है. It's something like that. If you start falling in love with your dentistry, everything else will fall in place for you.
Oh, wow, sir. You are the second guest who gave me the same dialogue of Shah Rukh Khan. I was at an interview with Akshata Prabhu ma'am, and she was also the same, that I got an dialogue of Shah Rukh Khan. Well, sir.
I think that in that case, me and Dr. Akshita Prabhu, we have a common love. That's Shah Rukh Khan. Yeah.
Um, well, sir, thank you for your insightful response today, sir. Your journey and
Most welcome. Most welcome.
expertise are truly inspiring, and we appreciate your you sharing your experience with us today. Thank you very much, sir, for taking out your precious time.
Most welcome. Thank you so much, Dr. Garendra. As I told you, this is something which is very different for me. I've spoken to people one to one, but then doing this on call, like an audio podcast, was my first experience. You're doing amazing. I hope you a lot of success and wishing a lot of happiness and smiles to you and all the listeners.
Thank you very much, sir. Thank you. Wish you the same.
Thank you so much, Dr. Ganendra.
Well, I'm your host, Dr. Ganendra, and as we wrap up this insightful conversation, I encourage all our listeners to connect with us on social media and keep an ear out for upcoming episodes of The Molarbear. Stay engaged, remain insecretive, and continue to share your wonderful smiles with the world. Thank you for joining us today. Bye bye.